and we're going to go for mechanism of absorption. It is very simple. So just putting it in a very simple way, nutrient, minerals and vitamins are going to be absorbed by energy dependent active transport against a concentration gradient. This gradient, sodium gradient, is present in the apical membranes of the enterocyte. So this is the apical membrane of the enterocyte. There is a sodium gradient which is going to be present, and there is a pump called a sodium potassium ATPase pump which is located in the basolateral membrane, pushing the sodium to extracellular fluid and maintaining a low intracellular sodium. So the sodium inside the cell is going to be low and outside the cell is going to be high. That is because of the sodium potassium ATPase pump which is located in the basolateral membrane. For glucose absorption in the intestine, two pumps are important. One is SGLT1, that is for glucose absorption, and sodium potassium ATPase pump. Enterohepatic circulation of bile acids. So bile acids are very important for fat absorption. So bile acids again are divided into primary, secondary. Primary is synthesized in the liver. There are two primary bile acids, cholic acid and chenodeoxycholic acid. Secondary is synthesized from the primary bile acid in the intestine by the action of bacterial enzymes. Colonic bacteria is going to act on the primary bile acids and going to make the secondary bile acids. Example of secondary bile acids are deoxycholic acid and lithocholic acid. If interruption in enterohepatic circulation happens, cholesterol absorption is going to be decreased by 10%. That is how important the enterohepatic circulation is. So in our body, there is 4 grams of bile acid pool which is being maintained. 500 mg of bile acids is being secreted every day, 500 mg of bile acids is being excreted every day, and that maintains a 4 grams of bile acid pool. The normal liver is going to produce the bile acid. So it's going to produce the bile acids. Bile acids are going to combine with taurine or glycine. These are taurine, this is for conjugation. The tauro-conjugated and glyco-conjugated bile is being produced. This is tauro-conjugated and glyco-conjugated bile. This bile acid is being secreted into the duodenum, into the bile. And now there is a sodium dependent active absorption which is happening in the ileum, and there is non-carrier transport happening in the jejunum, again ileum and colon. So based on this, the remaining bile after absorption of fat from here, portal vein carries them back to the liver. This is enterohepatic circulation. This happens 2 times when we eat. So basically if we average eat 3 to 4 meals per day, it's going to happen 6 to 8 times per day. So what happens to the remaining bile after getting used and absorbed? It is going to reach the colon. In the colon, this conjugated bile acids are again going to be transferred into deconjugated bile acids by colonic bacterial enzymes. Okay, this unconjugated bile acids will be rapidly absorbed by non-ionic absorption, and 0.5% only is going to be discharged in stools. Okay, this is the enterohepatic circulation. So first, liver is going to produce bile acid which is going to be conjugated by taurine and glycine and secreted into the duodenum. In the duodenum, in the ileum, that is going to, after being used for absorption, it is going to be carried back to the liver. Portal vein carries it back to the liver, and it is going to maintain the pool. Every day, that is about 6 to 8 times per day, the enterohepatic circulation happens. So 7-alpha hydroxylase, it's an important enzyme for cholesterol degradation.